Right. So again, we appreciate you coming to share all of the different programs that you have for the community, share those resources, and staying connected within this network. We appreciate being able to support the healthy aging of older adults, not even just in the Hyde Park area, the Chicagoland area, but we're reaching organizations throughout many counties. And that is one thing that we are very excited about to talk about today. So today, during our time together, we are going to hear from Sam Epps of AgeGuide. Sam is a forward-thinking advocate dedicated to enhancing the quality of life, promoting equality, and safeguarding the rights of older adults. She serves as the caregiver and dementia specialist for AgeGuide, focusing on federally funded programs under the Older Americans Act for older adults, those with dementia, and their caregivers. Okay, she is here to discuss federally funded programs that are available to older adults in the state of Illinois. So, the whole state, the Family Caregiver Support Program, excuse me, and funding available for persons with dementia and their caregivers. Before we bring Sam on, who I'm really excited to introduce, is there anyone that may have to leave early today and wanted to share a resource with us before they had to go? No? All right. Well, then, without further ado, again, I want to introduce Sam Epps of AgeGuide. Sam, the floor is yours. Thanks for being with us.
All right. Thank you so much for having me. I hope everyone's having a wonderful start to their week. Thank you, Renee, for inviting me here so that I can let you all know about all of the resources that we have for older adults. So I'm just going to share my screen. Okay, can everyone see my screen? Perfect, perfect. Okay, my name is Sam. Again, I'm the caregiver and dementia specialist for AgeGuide. We are one of the local area agencies on aging in the state of Illinois. We are an organization that provides funding to social services organizations for programs for older adults. So we don't provide a direct service, but we do provide the funding for a lot of the organizations within the state of Illinois that provide these services for older adults. So our mission is to help older adults age in place within their home. We want them to have a life of dignity, live in a safe space, maintain their independence, and also improve their quality of life. So there are a total of 13 area agencies on aging in the state of Illinois. We currently cover DuPage County, Grundy County, Kane, Kendall, Kankakee, Lake, McHenry, and Will counties. There is a AAA, we call them AAAs. There is a AAA for each county within the state of Illinois. So if we do not cover your county, then there is one that does. And if you need information on that, I can also provide that information for you at a later time. Okay. So in 1965, Congress passed something called the Older Americans Act. This act was funded to provide core services for older adults so that they can age in their own home. The minimum, the eligibility for this program is 60 years, being at least 60 years of age or older, and actually having a need. There is no income requirement for the program, so they'll never ask you for proof of income if you need any of the services that are provided. Also, you do not have to have citizenship for this program as well. I know I've had a lot of people ask me, say, hey, this person isn't a citizen. Do they still qualify for the services? Yes, they do still qualify for all of our services under the Older Americans Act. The only program that they wouldn't qualify for is one of our state-funded programs called the Community Care Program. So every other program that I'm telling you about, they will be able to qualify for. Okay, so our role is to plan, develop, coordinate, and deliver services to older adults within the communities that we serve so that they can maintain their quality of life. We have a lot of home and community-based services throughout the state of Illinois and in our 8 color counties that we serve as well. Our core services are caregiver services, nutrition services, health and wellness services, elder rights program, and supportive services. So we provide information assistance, options counseling, assistance with Medicare or Medicaid, benefits assistance, and outreach in order to educate the community on these programs and let them know what's available for them. We want to do this ahead of time because we want these services to be available to them before there's an emergency situation. So we try to do as much outreach as we can before something actually occurs. So some of our programs are provided in the senior services centers for senior activities within the counties that we serve. We also provide funding for educational programs, recreation programs, legal assistance through Prairie State Legal Services. We have a lot of funded partners that provide transportation, and then we also provide services for residential repairs as well. So one of the programs that I'm actually overseeing for the 8 collar counties is the Family Caregiver Services Program. So with this program, we provide support to caregivers. So this support can range from providing transportation for the care receiver, if they're needing assistance with like utilities, or if there's assistance needed with appliances or rent or mortgage, car repairs, anything that will help relieve the caregiver of stress and also benefit the care receiver, we will help provide that service for you. We also have respite care for caregivers. If a caregiver is going on vacation or just, simply just needs a break just to take time for themselves, we do have a program for respite care as well. We provide support groups for caregivers, training and education. We provide supplemental gap filling as well for those things that maybe insurance won't pay for, some of the durable medical equipment. And we also have a program for kinship families that is not for older adults. So with this program, to qualify, you have to be a relative taking care of an adult that is not your biological child. So anyone that is, even if you're under 55, you still qualify for this program. So the Older Americans Act pays for it if you're over 55, but we also have a state-funded grant that provides this same service for those that are taking care of a child that is not theirs under the age of 55. So with this program, it can provide assistance for clothes for school, if the child is needing shoes, or if they want to go to some kind of summer camp. And I've also seen where we've had someone in dual credit courses that, was in high school, but wanted to take a college course at the university. And we even helped pay for that tuition because it was going to benefit the child. So we have our nutrition services, which consist of home delivered meals. In order to qualify for this program, they do want you to be homebound and at least 60 years of age. Although that was one of the qualifications and that's the focus of the program, they during COVID, they kind of started getting rid of that qualification where, if you are in the home and you're 60 and older and you can get around, you still can qualify. There's also the congregate dining program. So with this program, they have different meals served on different days of the week at different times at different locations. These locations vary. Some of them are at senior living facilities, community buildings, senior centers, and we've also partnered with some of the local restaurants in the counties that we serve too to provide meals as well. And with this service, it's free of charge. They sometimes ask for a donation, but it's not required. The older adult will not be denied any type of service if they choose not to donate. So we have our elder rights services, which includes the Adult Protective Services Program. So this is a program for adults that are 60 years of age and those 18 through 59 with a disability living in the community. So this program is for those where maybe there's a suspected abuse, exploitation, neglect, or self-neglect, or if someone suspects this, then they would contact Adult Protective Services, and our organization does provide funding for that program as well. Here's the 24-hour hotline that's available if you are wanting to just take note of this just for your for future references. We also provide funding for the Ombudsman program. There's the long-term care ombudsman that provides serves as an advocate for like long-term care facilities, and then we also have the home care ombudsman that serves as an advocate for those that are in the community. Then we have legal services available for no charge for older adults. Basically, if there is an issue where there's not adequate housing, if there's a safety concern, any legal thing that to meet their basic need, they can contact the provider that we use for legal services, which is Prairie State Legal. So we also have a lot of health and wellness programs. We have a Matter of Balance, Fit and Strong, Healthy Ideas. We have like a stress busting program. And then we also have programs that are not a part of the Older Americans Act that we provide funding for. One of them is called the Veterans Directed Care Program. So if anyone is a veteran, they can apply for this program. We do not determine the eligibility for this program. That's something that the VA does, but we do have funding for it. So this program will provide in-home caregiving, caregiver support, home maintenance, options counseling, transportation, adult daycare services. So the whole point of this program is to also help the person age in place because they want to try to keep individuals out of facilities as long as possible so that they can maintain their quality of life. So during COVID, we recognized the need for programs for social isolation. We started two programs called the Telephone Reassurance Program and the Friendly Visits Program. So with the Telephone Reassurance Program, you have a volunteer that will provide phone calls to the older adult. I think it's like 2 calls a week just to do like a wellness check, or if they just want to talk about, you know, how their day went. We have volunteers that can provide that for them. And then we also have the Friendly Visits Program, which is pretty similar to the Telephone Reassurance Program, except with this program, it's in person. So they would actually physically go to the older adult's home and just, you know, spend time with them, you know, maybe once or twice out of the week, whatever they decide is comfortable for them. We had this one lady talk about her experience with the Friendly Visiting Program, and she even had her volunteer hanging up curtains. So if you need help hanging up curtains, I guess you can have somebody join the Friendly Visit Program. So we have a statewide initiative related to Alzheimer's disease and related dementias. So with this project, we implemented something called the T-Care program. It stands for Tailored Caregiver Assessment and Referral Program. So with this program, you would take like an assessment, do like a screen or an assessment that basically will identify what your needs are. It basically kind of identifies where your caregiver stress is coming from so that the provider can better assist you and give you some kind of directional on what programs may be best for you. So this is for the T-Care assessment is for the caregiver in order to help them or the care recipient as well. Then we have something called the Stress Busting Program. This is a 9-week evidence-based caregiver stress program. In this program, it can be in person or it can be virtual. Basically, it's going to help you learn techniques in order to deal with stress, and also it's going to help you give you some kind of scenarios. Like if there's a situation that happens, it will kind of give you some tips on how to handle that situation. With this program, a lot of caregivers have realized that how the tips that they've learned and the stress techniques that they've learned have actually helped them have more of a positive view towards being a caregiver as well. We also have the Tablets to Seniors program, where we provide free tablets to promote online connections so that they can also prevent social isolation as well. So next I'm going to talk about one of the state-funded programs, which is the Senior Community Service Employment Program. So with this program, it allows older adults that are at least 55 years of age or older to just gain some work experience, or, you know, also gain income, and it also helps prevent isolation as well. They'll help them gain employment in places such as nonprofit organizations, schools, hospitals, senior citizens. The average participant will work about 20 hours a week, and they're paid at the highest federal and local minimum wage level. To qualify for this program, they must be at least 55. They can't be employed, and they can't have a family income of no more than 125% above the federal poverty level. So with this program, they do give preference to those that are veterans and their spouses as well. And then next are those individuals that are 65 years of age or older. So we have another program called the Senior Medicare Patrol Program. This is also a state-funded program. This program is actually administered by another AAA called Age Options. Age Options does exactly the same thing that we do, but they cover suburban Cook County. So they started this program, and we kind of adopted it as well. So with this program, we teach Medicare beneficiaries how to protect themselves from Medicare fraud, how to detect Medicare fraud, and basically how to report it as well. I also wanted to talk about something called Triads. It's not necessarily a program that we have. We provide funding to Triads, you know, in past years, but I just wanted to put focus on this program. I don't know if anyone has heard of Triads, but Triad is law enforcement, older adults, and social services organizations coming together just to educate older adults on things that relate to them and whatever topic is popular at that time, but the focus is preventing them from becoming victims of frauds and scams. This is a very great organization or group of organizations because a lot of adults are becoming victims of scams and frauds, and a lot of scams are developed every day. We can't keep up. So this is something that the state of Illinois wanted to focus on. There are 12 triads within our 8-county region. Chicago, I don't think they have any, but I know Suburban Cook has 2, one in Lamont and one in Tinley Park. So if you all are interested in becoming a part of Triad, please let me know. We also have a Triad toolkit that has all the triads listed in the state of Illinois on our website. But this is a great program because not only does it educate them, it also provides that social isolation piece because they sometimes have like parties. They're kind of like parties to me because they'll dance, they'll meet people, but they also get access to resources as well while they're having fun. So I also wanted to talk about our caregiver portal that we just launched on Friday, actually, or the 7th, whatever day the 7th was, we just launched this portal. This is a online portal for caregivers. This is not only caregivers for older adults, this is also caregivers for those that are part of kinship families as well. So with this program, you have access to a lot of toolkits, resources on how to relieve stress, how to handle situations, that maybe you're dealing with your caregiver, your care receiver, or the child that you're taking care of. You can even like type in a disorder or disease, and it will bring you all the resources for whatever that condition is as well. So we've had heard testimonials from other organizations that have this program, and it's been reported that it has relieved caregiver stress, and it has also helped reduce hospital readmissions, and also has lowered costs as well for the caregiver. So if anyone is interested or knows a caregiver that would benefit from this program, they can sign up at ageguide.truealta.com. And this platform is completely free. It's very quick to sign up. It's accessible 24/7. It doesn't require an app, but it is able to, it does work on your phone and your iPad or whatever kind of device that you have as well. So that is pretty much it. I hope you all learned a lot of stuff that you didn't know. Does anyone have any questions?
It looks like you have a few interested in being part of the triads, and they've added their email addresses to the chat. So you may want to take a look at those.
Yeah, for sure. Yeah, I'm gonna write those down in a little bit. But
Perfect.
yeah, that's awesome. And then also, I do see where Renee uploaded some flyers that I sent her. There's one for the Kinship Family Program. There's one for the Alzheimer's and disease related disease program, Illinois Family Caregiver Program, and our True Alta platform as well. Again, these services are free. With the ADRD program, I forgot to include that that service is available for caregivers that are caregivers that are taking care of someone with Alzheimer's or dementia, and it's also available for the person with dementia. So it provides funding for pretty much everything the family caregiver program does, like mortgage, rent, car repairs, all those things, but you just have to have some kind of suspected memory loss or Alzheimer's or dementia as well.
Fantastic. Great resources, and you're hearing that loud from our network here. We have two questions for you. Harriet, I saw your hand go up.
Yes. Thank you for this excellent presentation. And I'm on my iPad, so I don't know how to save the chat. I assume, Renee, that you'll be sending out the slide deck, right?
Absolutely.
Samaria, thank you. That was excellent. And I live in Lake County and have a family member in McHenry County too. And
oh, perfect.
Both of them need a little extra support and definitely want to age in their own home, as do we. So that's very helpful. So the AgeGuide you're sort of the blanket to connect people to other services, and you help fund the services. Is that correct?
Yes. So we partner with different social service organizations that apply to receive funding for the year. So we have the funding available for different programs. It varies by county. So we have like different county resource sheets. I can also send that to Renee. I didn't want to send it because it's like 8 of them, because it's one for each of the different 8 counties that we serve. But whatever organization provides that need, you would contact them directly for that service. But we are just the ones that provide the funding, and we get the information out as well about what's available that we're providing funding for.
Can I ask a second question?
Sure, go ahead, ask me as many as you want.
Oh, I probably lots. I see an opportunity to use this beyond the what I call the collar counties area.
Mhm.
So all across the United States, there's these what are they called? Area aging agency or something.
Yes, ma'am.
So I've been participating and working in rural churches. So this might be something that churches could connect people to. I mean, and this is across the country. I'm going to be in a
Yeah, for
meeting
sure.
tomorrow afternoon with people from Pennsylvania and Iowa. And how would I connect them? What's the best way to connect them to these services?
So they would have to figure out who their area agency on aging is for that county that they're in, and they would be the ones to connect them for the services that they have available.
So the first step is the area agency on aging, AAA, right?
Yes, yes, it's called, yes, the AAA.
Is that government?
So that is, yes, it's something that it's an organization that is funded through the federal and state government. So every county has an area agency on aging. It just varies. Not every county has the same services, or not every AAA has the same services that they provide, because you can kind of pick and choose which programs you feel are best for your organization. So although we have all of these programs, other AAAs within the U.S. can decide, okay, which programs do we want to provide under this umbrella
I got it.
of service?
And
Yes,
and
ma'am.
I did go to AgeGuide looking for something, and
Mhm.
it seems that McHenry County has fewer services than Lake County. And I have worked with age options for a former employee. So there's really quite a variety, right? In terms
Yes,
of
there
what
is
can
a
be offered.
variety.
Okay.
Yeah, there's a variety. In McHenry, they have a lot of programs. It's just that certain counties may have like one provider that provides like pretty much 70% of the services.
Oh, actually, I think that's,
Mm-hmm.
okay. I think that's, and some townships are much more aggra- I don't know, much more empowering to the people. I mean, like in Cook County, Wheeling Township is wonderful compared to, let's say, Lake County's Vernon Township. Yeah,
Oh, wow.
a big variety.
Mhm. That's good.
There are
Yeah.
Thank you so
there
much.
are yeah, I Harriet, I agree with you on that one. There's some counties that have more programs available. If it's transportation or things like that. That's why, it's good to be able to get all these resources looped in one. And I put the age guide as well as the area agencies on aging in the chat so everyone can access that as well and take a look. And Regina, I see your hand up as well.
Hi. Thank you, Sam, for sharing this great information. I think you mentioned something earlier that I might not have been clear on. You mentioned all the different counties you are serving. What did you say about Cook County? In case.
I was saying we don't serve Cook County, but there is a local area agency on aging that does. We have age options for suburban Cook County. For the city of Chicago, I can't remember. It's on the website. I can get you that information. I think it's, oh, I keep forgetting. Someone asked me and I gave them the information before, but I totally forgot. But there's 13, and Chicago's so big, they have their own, you
Okay.
know.
I,
Yes, ma'am.
okay. I don't know. Maybe it's Aging Connections. I'm not sure, but you're right.
They have
Chicago.
the Chicago Department of Family and Supportive Services as one of
Yes,
them. That's, yeah.
yes, that is it. That is the one for Chicago. Yes.
Hmm.
Thank you.
Any other questions? No? Okay. And really quick, I know that question came up. Here's the website for the Chicago. Area Agency on Aging. You can get a lot of their flyers here. They do have a lot of programs. It does take them a little bit to update here and there, but I think they still put a lot of great information in here. They'll talk about, Sam mentioned like the Golden Diners program. They have those listed in here. They have some of the, they'll put like all the heating and the cooling centers and things like that too. So each of the websites do have a lot of information available to you. But Sam, thank you so very much for this wonderful presentation and for all these resources. And if you're okay with it, we'd love to be able to share this. We can send this out to everyone along with all the flyers. So yes, everyone, I will send out those flyers. In terms of the chat on the iPad, Harriet, you can we can send all these resources. I'll save them and I'll at the very end, and I'll make sure I'll send out all those different area agencies on agings and the websites and things like that for you too. Okay. But yes, thank you again so much, Sam. We really, really appreciate you and all of these great resources for across the state.
Thank you. I appreciate it. And if anyone wants to contact me, here's my email and my phone number on the screen. So feel free to jot it down and email me if there's any other questions that you may have.
Perfect.
Thank you.
Thank you. And before we get started, wanted to have one of our team members pop in and talk a little bit about our resource guide, and give you some updates and some information here. So if I can have Jeff Grotner of our team, there he is, he's ready for us. Jeff, I'm going to hand you the floor, talk a little bit about our resource guides.
Cool, thanks, Renee. Yeah, it's really just a quick update here. We're currently working on the 25-26 edition of the Share Network Southside Resource Guide. Hopefully you're all familiar with that guide by now, but we would love to get feedback if possible from you in multiple ways here. I'm going to post this in the chat. One, there is a resource guide survey. This can be found either at this link or a QR code on the actual booklet of the last resource guide. Most importantly, there are some open-ended questions at the end, such as like, what can we do better next time? What sort of things would you like to see that aren't already in the guide? And finally, any submission requests or any resources that you don't see, let us know those. So that's the first link. The second link is if you're at a community organization who is not in the guide already, and thinks you should be in the guide, we have a Google form at the second link here. This sort of lets you, write your own description how you'd want it, and then, we'll take a look at it and make sure it fits our criteria for the guide. And then lastly, just if you have any general questions about the guide, and what should go in the guide or what shouldn't, feel free to email me or contact me, however. So yeah. Any questions right now, I guess I should ask? Cool. Well, thanks so much. Oh,
I have a question.
hey, Susan.
Here. So what is your timeline? When will the new one come out? And do you still have the current edition available?
We are currently we're getting pretty low on the current edition. So I think we're gonna have to be a little smarter about how we distribute the final resource guides. We are aiming for around the same time as we did the last edition, which is late spring, early summer, for 2025 to 2026.
Thank you.
But we do promise to let you know as soon as we're ready to come out with those, and we'll share with you when they're printed and so on. And any of those individuals that are part of our hub will also talk to you about making sure we get those filled out and things like that too. So Susan, no worries. We'll make sure we've got you covered, and we
Well,
appreciate you
also,
distributing them for us. So,
your timing is good because the farmers markets like to have them to distribute.
yes, yes, absolutely. So, we want to make sure we get those out just in time for that. But thank you. And thank you for thinking of that too. We appreciate that very much so. And thank you, Jeff. I will also include those links. So if you didn't get a chance to take a look at them now or you have to rush off, I'm going to make sure to include those in our wrap up email too when I send out, the link to this as well as all of the different flyers. So it looks like we've got a lot of people that are sharing some flyers here. So I really appreciate you doing so. But yeah, thank you again, Jeff, for popping in and sharing that great news. We're excited to be working on this next edition and want to make sure it's full of resources that make sense for everyone. So we appreciate, you being able to help us with that process because, you are part of our network here. But as we're thinking about our community and as we're thinking about our network, I see we already have Regina talking about the older adult social cafe and sharing some resources here. Regina, is there anything you want to share? Do you want to talk a little bit about that?
Oh, sure. Thank you, Ms. Renee. Just want to invite you all or let your clients know that they are welcome to join us for our first socials, Older Adults Cafe, and it's going to be at our lovely campus on 5139 South Ashland in our Center for Discovery and Learning. We'll have refreshments, have some interaction, meet some of the teams that we work with. Hopefully, Cheryl will be there to share some, and our dementia-friendly community is going to be there also. But it's just a safe place for older adults to just come meet each other, and at the end there will be a food giveaway where we have a vendor who will be providing some free take-home groceries. Not too heavy, just enough that you'll be able to carry it home. So everybody is welcome. Feel free to call and let us know you're coming. Otherwise, just show up and we'll be happy to see you. Thank
That's
you.
exciting. Thank you for sharing that. I really appreciate that. That's going to be a great event. I wish I would have been able to get that into our newsletter, but definitely I will send that out to everyone that wasn't able to attend. So thank you very much for sharing that.
Thank you. You're welcome.
Yeah. Anyone else? Any other big resources? Any big events coming up? I know it's the holiday month and I know we've got a lot going on. But any other big things coming up for November?
Um,
All yours?
so we do have our Thanksgiving community dinner on Thanksgiving Day. Um,
Fantastic.
the fee is $12 or pay what you can. It's open to anyone. Of course, we do have a limit how many we can accommodate, so we ask you to register. Um, and also, we deliver meals to homebound people in the Chicago, in the Hyde Park area. We can't go too far afield, but within the Hyde Park nearby area. So if you know of someone who's isolated, lonely, by themselves for Thanksgiving, let us know. We'll deliver a meal to them.
Susan, that is wonderful, and I'm so glad you're keeping up with that. Do you or Lucas, by chance, have a flyer or anything that we can send out, or just a snippet of information to make sure we can share that with everyone, for especially for those who weren't able to make it today?
Lucas, do you have a copy of the flyer, or we can send it to you so it can go out with your mailing?
That would be wonderful. We really appreciate that. I think that's great news, especially in the Hyde Park area, just being able to get out some information to everyone locally. So thank you. That would be wonderful. Anyone else? Any other big events? Okay.
I have
Nope,
a
I see Phil.
couple.
Go ahead,
Hey,
Phyllis. I saw it coming through.
yeah, sorry, my camera's acting weird today. So one of our partners, Africa Health International, is having a pre-Kwanzaa celebration. Mm, so South Loop Village is also a sponsor of this event. And so there'll be lots of different things. I think there's going to be a fashion show and some art exhibits by seniors. A few of our super aging researcher participants will be featured. And so I think it's a fun pre-Kwanzaa celebration for all older adults. So sharing that. And then also, Janie and I, from South Loop Village, have been working with the Hall Branch Library to bring memory kits. And so these are the first memory kits in the Chicago Public Library system for people with Alzheimer's disease or dementia and their caregivers. And so we are super excited that they're live and ready to check out. It's the Hall Library on 48th in Michigan, and I will get a flyer in the chat. So please check them out. They're really
Beautiful.
wonderful. There's a jazz theme and a nature theme, and they seem lots of fun. And we've gotten some good initial feedback, but looking to have more people check them out so we can get some feedback and get more across the city. Anything else,
That's
Janie?
exciting.
I think that's it. I think it's the culmination of over 2 years of work to try and make this happen. And so to say we're super excited is, like super duper excited. And the only way that we can expand this initiative is to tell everybody about them and hope that those who don't live near the Hall Library will ask their local library to introduce memory kits. So some of the people that have evaluated them for us have said, I'm going to go right to my local library and ask them why they don't have memory kits and when they're going to get them. So we're pushing for that. The kits are really great. They're full of fun stuff for people to do and see. And we're keeping our fingers crossed that people will get busy checking them out and enjoying them.
That is wonderful. And I'm so glad you're doing that. And I love hearing that. I remember the first time I saw one in a library out in actually out here in the suburbs and hearing that they're being expanded. I know we have Tinley Park that just became dementia friendly. Orland Park is dementia friendly. We've had so many different organizations that are now growing. So congratulations to all those community partners that are expanding all that great work. I know we put some information about becoming dementia friendly and what does that mean in our newsletter in October. So please make sure if you're on that newsletter to check that out and learn more about what that means and where the communities are because we're growing. Illinois has so many. And Phyllis, do you remember how many we were at for the dementia friendly cities or communities in Illinois?
I don't. Janie might
Okay.
know the answer to that.
You
Oh,
know, I
Jamie.
I knew at one point, and now I've lost the number, but it's what was amazing to me because we do have so many. I always thought we had the most of any state, and it turns out that we're actually number 3 or something in terms of dementia-friendly communities. But I believe it's in the 40s somewhere
That's awesome.
in the
That is
state.
awesome.
In the
Yes,
state.
just in the state. I know, that's fantastic. Beautiful. That is a great thing. And again, please feel free to check out that information. Actually, in here, if you didn't get a chance to, let's pop that into our Zoom, show everybody a little bit about. And it looks like you were really close, Janie. It was 39 was our last numbers that's on the website. So woohoo, that is fantastic news. Love hearing those grow. I remember when I first started, we were in the early 30s, and now here we are, even just coming around to 40. That's exciting news. Thank you. And I saw somebody with their hand up. Did somebody still have their hand up? No. Okay. Maybe not.
It was, yes, it was Harriet, but
Oh, Harriet. Hi there.
always more questions. So here we are in Lake County and Warren County. Well, I know my library does have a dementia friendly, so I need to go about that. But I'm wondering about the villages. I know Chicago and Cook County has active villages, and I assume at some point you'll have another share event about villages. But as you know, you expand this beyond Hyde Park. Are there villages in Lake and McHenry and Mercer County? Probably never heard of Mercer County.
To my knowledge, they're not. In Chicagoland, we have 7 villages, but I honestly, this is Janie, I honestly don't know of any outside of what we call the greater Chicagoland area at this point.
Is there a website to find those locations?
Yeah, if you go on Village to Village Network or the initials VTV Network, there's a map and you can find all the villages in the country. So yeah, you can hone in on Illinois and sure by state, by whatever you want.
Thank you.
Mhm.
I just put that in the chat as well, so we can take a look at that. Thank you for sharing that website, Jeannie. Appreciate it. Okay, fantastic. And it looks like Lucas put up the Thanksgiving flyer. Thank you so very much. Gonna make sure that gets out as well. Phyllis, you put up the memory kits flyer. Fantastic. Lots of great information out there. And I'm really thankful that we have this opportunity, and now that we're talking about Thanksgiving, just a moment to say thank you. Thank you to all of you, not only for attending these monthly meetings with us and sharing the support, but just for your unwavering commitment and for supporting the community like you do. We appreciate the dedication that you have to improving the lives of older adults, and your partnership is truly essential, and not only just for the community, but just for us to be able to help provide all that we do alongside of you. So thank you for being part of our network. We are very appreciative of you. And as we close up, are there any other resources, any other events coming up? No? Well, all of our wishes from the Share Network for a happy and healthy Thanksgiving to all of you. Oh, wait, I hear, was that Ingrid?
Hi. Yeah, I was just letting you guys know about a turkey drive that is coming up through Bright Star Community Outreach.
Fantastic. All right, that is also going in our sheet here, just making sure we get all of that great information. Wonderful. Well, again, thank you all for being part of our monthly meetings, for being part of the Share Community Partner Network, and for all that you do. We are wishing you and your families, and everyone that is important to you, happy and healthy Thanksgiving. Take good care, and we look forward to seeing you in December.